what we're going to do today is something called Thermirase, where we're actually going to selectively go after the nerves that innervate this area. Normally with Botox, we have nerves that innervate these muscles directly, and we put Botox into the muscles and it blocks the transmission of the nerve signal to the muscle. That's great, except it doesn't last very long. What we're going to do is actually go after the nerves that selectively innervate these muscles, and we're going to ablate them using the new Thermigen device. The first thing that we do is actually stimulate the nerves externally so we know where we're going. Let's see, so I'm going to touch it right here. Good. And now we know we don't want to go there because it's raising the eyebrow. So let's go a little bit further. There we go. And you can see that she's got a little bit of movement right in here. So that's where we're going to make our first lesion. Next we're going to go after is the angular nerve, which innervates the bottom portion of these muscles. Now, to get to this spot, we go in here. The other thing I do to make sure that it doesn't hurt, put a little numbing medicine where the nerve for sensation comes in, both laterally and on the nose. Now let's do the same thing on the other side. So, what we're gonna do, stimulate again. Up, see? You got the little twitch. That's what we're looking for. Anything up laterally. Can't miss that one. Now, once again, as on the other side, which you probably didn't see very well, but we'll go in through a little pinhole right there after we make it numb. Punch right here. See those lines right there? That comes from a muscle that goes from here to here. And sometimes you can't really get that well with Botox. Good twitch all the way up into there. Once again, I'm going to put some numbing medicine right in here. Now, when I inject numbing medicine into the face, I have this wonderful little device that actually vibrates. This is going to feel kind of weird. Feel that? When you have that on your skin, you won't even feel me sticking a needle in you, okay? So now what we've done, I've blocked a lot of the nerves. So, and it's actually not that bad, was it?
No, not at all.
So, and that's what's nice about this, once again, is we're going after the motor nerves, so we can selectively go after the sensory nerves to block those so that it doesn't hurt. It makes such a huge difference compared to how the old machines that did this work, because this allows us to actively stimulate those nerves. So what we're going to do now is just clean up a little bit, and then we're going to do the first side. All right, the first thing we're going to do is go in and get the little nerves down in here. The way we do that, we make a little pinhole in the skin. This is actually the same kind of needle that we use to give regular injections with, but it's numb. So we're going to go in here. So let's turn that on to 0.3. Let's go ahead and go to 0.4 and leave it there. All right. All right, so that was our first lesion right there. See, you squinch. Now if you can see that the bottom part isn't squinching anymore. We got squinching here, and here, and here, but not right there. And that's how fast this works. Now the reason I like to go out here laterally a little bit is you'll get a little heat effect on the probe, where the probe goes in, and this is not really intended, but it actually will tighten up the skin there a little bit. So it helps out with the crow's feet. And right now, there's two muscles here. There's the muscle that surrounds the eye, which we don't want to get, and there's the muscle down below called the frontalis, which actually lifts the eye, and we don't want to get that either. So I'm right between the two, and what we're going to do is just get to the ones that stimulate that, and look at that. All right, so now we've got one there. Now I'm going to go back to stimulation, and I'm going to go find the next nerve I want to get. And look, it is right there. Sometimes it changes when you're in there, from when you mark it. The marking is just giving you an idea before the treatment where the nerves, you know, the general area. But with the probe, I can get so close to it. Now, here she is. We've done this side right in here. Now I want you to squinch these muscles. Look at that. So this isn't working. You see a little bit here, but that's just because this is pushing over. But look at that. That's completely relaxed. Here I can't pull, but here I can. Relax. Squinch again. Okay, so we're going to do a little stick here. All right, we got those done. Home stretch. Let's see you squinch. Okay, now what we've done, we've treated this area, and this area. Now squinch, and see, that's all that's moving. Squinch again. Just got a little bit left there, and then we're done. And that's what's great, it's immediate. Let's see if we can find one more. And that's a good one too. Look at that. So I'm gonna come on out. Let me see you squinch. All right, even the little bunny lines right in here are gone. Yay. Which are really hard to get with regular Botox unless you get down here. And we have our one tiny little bruise from putting in the local initially, but that's not even from doing the procedure. That was just me putting some numbing stuff in. But it's all gone. You did wonderful.
Thank you.
Thank you. We've just finished Thermirase with Laura, where we selectively ablated the nerves in the glabella region, what we usually treat with Botox.